Cutaneous T-cell lymphomas, or CTCL, are a type of non-Hodgkin's lymphoma. They account for the vast majority of primary cutaneous lymphomas. The CTCL subtype mycosis fungoides, or MF, is more common, comprising around 60% of CTCL cases. Sézary syndrome is more rare, as you can see. It makes up roughly 5%. Together, mycosis fungoides and Sézary syndrome comprise around 2/3 of all CTCL cases. CTCL primarily manifests in the skin, but other disease compartments may also be involved, including lymph nodes, viscera, and blood. Mycosis fungoides may be indolent with skin-only symptoms. Still, it has a heterogeneous presentation even within the skin. Mycosis fungoides may also involve other disease compartments. In fact, 1 in 3 patients with mycosis fungoides may experience progression within skin or to other compartments, including blood. Sézary syndrome is a more aggressive subtype. It is defined by high levels of blood involvement in erythroderma, intense pruritus, and often lymphadenopathy. It is associated with a poorer prognosis. Now, let's take a closer look at how mycosis fungoides and Sézary syndrome are staged and how staging can inform prognosis. Clinical stage is determined using the TNMB system. It evaluates the level of involvement in each of the disease compartments. In the TNMB classification system, T represents the extent of skin involvement as well as lesion types. Lymph node, or N, is determined by the histopathological features of lymph node abnormalities. Viscera, or M, depicts the absence or presence of metastatic involvement, and blood, or B, highlights the level of blood involvement in the disease. Blood classification was added to the TNM criteria for mycosis fungoides and Sézary syndrome in 2007 as an independent prognostic factor. Blood involvement is determined by counts of abnormal cells and T-cell clone status and is classified as B0, no significant blood involvement, B1, low blood involvement, or B2, high blood involvement. Here are the full classifications for B0 to B2 blood involvement. To review them, feel free to pause the video or explore probeandctcl.com. Next, this is how clinical stage is determined based on combining all 4 TNMB criteria. And the TNMB classifications that comprise each clinical stage are shown here. While high blood involvement is always considered advanced disease, regardless of other compartmental involvement, blood can be involved even in early stage disease. In fact, one study found that roughly 1 in 5 patients with early stage mycosis fungoides have B1 blood involvement. But why is blood involvement so important? In mycosis fungoides and Sézary syndrome, blood is an independent prognostic factor and is associated with worse outcomes. Shorter overall and disease-specific survival have been correlated with increasing blood involvement. In fact, one study showed that patients with B2 or high blood involvement have a 4.6 times greater risk of disease progression. Now that I've discussed the importance of blood involvement in mycosis fungoides and Sézary syndrome, what does the workup look like? No single diagnostic test is available for mycosis fungoides or Sézary syndrome. Because these are multi-compartmental diseases, NCCN guidelines recommend a multimodal approach for diagnosing and staging. A full workup with evaluations of all of the 4 compartments is important for accurate diagnosis and staging. Workup should include skin exam and biopsy read by an experienced pathologist, palpation and CT scan of lymph nodes, palpation and CT scan of viscera, and flow cytometry to assess blood involvement. Flow cytometry is an assay that is ordered from the lab. It provides qualitative and quantitative measures of abnormal T cells in blood. Flow cytometry should be done at diagnosis and when certain clinical flags appear through the course of your patient's journey with mycosis fungoides and Sézary syndrome. To learn more about when to order flow cytometry and how flow cytometry works, watch the video in this series presented by Dr. Alejandro Gru, Dermatopathology Section and Fellowship Program Director at the University of Virginia School of Medicine. Here is the key takeaway from this video. Blood involvement is an important prognostic factor and it should be monitored both in mycosis fungoides and Sézary syndrome patients. I hope the information in this video is useful. Thank you for watching. For more information about flow cytometry for blood involvement as well as example clinical cases, explore probeandctcl.com.